This is a summary of what I can see on the axial skeleton, looking at the whole skeleton instead of separate bones. So we can see we have the skull. Remember, we have the cranial part of the skull surrounding the brain, and we have the facial bones part of the skull making up the face. So for the skull, I can see a nice frontal bone, parietal bone, temporal bone, occipital bone back here. There's that occiput I was telling you in the back of your skull that you can feel on your occipital bone. See a couple of suture lines here down the middle here. It's a sagittal suture line. That's the lambdoidal between the occipital bone and the parietals. And then we have the squamous flat suture separating the temporal bone from the parietal. And then we have the coronal suture behind the frontal bone. In the temporal bone, we can see the nice zygomatic process that ends here at this suture line. You can see the external auditory meatus, the ear hole. See a nice big mastoid process. The muscles connect to that to help you turn your head and move your jaw. Here we have the zygoma bone right here. It extends up here to the frontal bone, over here to the zygomatic process, over here to the maxillary bone. That's your cheekbone, the zygomatic bone. Here we can see the maxillary bone right here. Proceeds up to the frontal bone and down to the teeth. So that would be the alveolar margin where it joins the teeth. Frontal process proceeding towards the frontal bone. As far as the mandible goes, we have the condyle. And where the condyle connects with the temporal bone, remember they called that the mandibular fossa, right there, of the temporal bone, condyle. This vertical part is the ramus. We also have an alveolar margin here with the teeth. There's your mental foramen in the chin for nerves and blood vessels. I told you about the mandibular foramen. You have to look on the interior of the jaw, and there it is, right there. Mandibular foramen for the big nerve coming from your brain to all your teeth. Here we have the nasal bones here. Lacrimal bone, remember, had this little depression in it for tears to drain into your nose. Of course, the orbit there is about 8 bones. Can't really see the ethmoid and sphenoid cranial bones unless we take off the skull cap. We can see them from the side a little bit. Sphenoid wing here. This is part of the ethmoid in here. Part of the sphenoid. If we look in the nasal cavity, we can see part of the ethmoid coming down here as a perpendicular plate, and we can see the middle nasal concha there. Here's some other concha. The vomer bone we didn't have on our list. Here we can see a nice view of the hyoid bone right here. Okay, now they have that connected here to the vertebrae, but it's not really connected. It's free floating. Be out here a little bit. Remember I had you feel that under your jaw. Move your fingers down under your jaw and you can feel that, and you swallow. It's going to move up and move back down because there's lots of swallowing muscles attached to that. And we have our vertebrae here. And this here is C1, the atlas. I can see my occipital condyles coming down to fit into the fossa of the atlas. You can also see C2 here. We can't see the dens, but the dens would be sticking up into the atlas there. All these cervical vertebrae, 1, 2, 3, 4, 5, 6, 7, have the foramen and their transverse process for the vertebral artery to go to the brain. We're going to have a carotid artery coming up here, going into the more anterior part of the brain. There's a couple foramen in the skull under here. You can't really see them. For the carotid artery to enter the brain, called the carotid foramen. We can see parts of the vertebrae here. Spinous process. You can see the bodies from the front. Intervertebral disc. There. We can see the intervertebral foramen where this wire is coming out and where nerves would come off the spinal cord. The spinal cord would be running up behind the bodies, be going straight up in the vertebral foramen, which we can't see because they're all stacked on one another. And then when we move down here, that hole in the transverse foramen, transverse process called transverse foramen, that disappears because now we have the thoracic vertebrae, 12 of them, and notice they're all connected to the ribs. This top rib is really small. There's your second rib. Let's turn this a little bit. So learn to appreciate the connections that the ribs have to these thoracic vertebrae. 12 of them. 12 ribs. So you can see that they come around and they actually connect in two places. They connect on the transverse processes of the thoracic vertebrae, making a little costal facet there, smooth area. And then they also connect to the body in here. That also has a facet on it that's smooth, indentation. And we get down to the lumbar vertebrae, 1, 2, 3, 4, 5. Big, bulky. Remember I said you can kind of look at the shape as animals also, because these look like giraffe noses and they point down. The lumbars look more like mooses and they also point down. The tips of the cervical spinous process often were bifurcated, have a little notch in them. And that animal, well, it looks kind of like a calf to me. Let's look at the anterior again with the rib connection. So the ribs have this sharp curve in the back, and then they come out broadly in your chest. And notice they end and have costal cartilage on the ends of them. And the costal cartilage is actually what connects to the sternum. Here is the sternum. 3 parts: manubrium, body, and this xiphoid process. Remember I told you can kind of push in on that xiphoid process in real life even. And I mentioned that's a landmark. You feel the ribs where they join. You put your 2 fingers here, and then you put your 2 more fingers up and put your palm right there to do CPR. So you feel the xiphoid, go 2 fingers up, and then put your palm. And the heart would be right under there. 1/3 of the heart comes over to the left, but the bulk of the heart is right there under the sternum. True ribs, false ribs, floating ribs. Well, the first 7 ribs are called true. 1, 2, 3, 4, 5, 6, 7. And that's because they have their own piece of cartilage coming up to join the sternum. 8, 9, 10, they join the cartilage of 7. So they're called false ribs. They still have cartilage, but they join 7, so they're called false ribs. And 2 other false ribs are also called floating ribs, because you can see they don't have any cartilage, and they're just kind of floating there. So 11 and 12. Floating ribs are also false ribs, because they don't have their own cartilage. And then we went down here, and we could see the sacrum. After the lumbar vertebrae, we have the sacrum here, and then the coccyx part here. And remember, the sacrum is going to connect the 2 pelvic bones, the 2 hip bones. And come around to the back. And we can see this sacrum. It's actually 5 vertebrae that fuse together. You can see the crest here, the sacral crest, that used to be the spinous processes of vertebrae. The nerves can come out here, the sacral nerves. And then we have the coccyx, which is actually 4 fused vertebrae. Again, notice how they join the hip bones. So I think that's about all you can see on this for the axial skeleton. You can see a nice S-turn in the vertebral column there. Make your S. Okay, that's what I can see. That's what I can see on the axial skeleton.